The College of Pharmacy has gotten involved in workforce education for several reasons. The primary reason is because pharmacists who graduated 5 to 10 years ago have not had the opportunity to have pharmacogenomic education. It has become common for pharmacies in healthcare systems to be implementing pharmacogenomics, and their education in this area is needed.
Pharmacogenetics has been very important in the last few years in my patient population that I see. We actually have increased the amount of patients we're doing pharmacogenetic testing for quite significantly. So it's become a fairly regular part of my day-to-day job.
We've received substantial feedback from the practice community that pharmacogenomic education is important. They are realizing now that this is either being implemented in their healthcare systems or they anticipate that it will be implemented in their healthcare systems, and they don't feel prepared to handle pharmacogenomic information in the context of patient care.
With a certificate program through the University of Minnesota, I was mainly interested in it because we're using a lot more testing. I wasn't as familiar or comfortable interpreting some of the results. I really wanted to gain more experience and feel more comfortable using these tests and helping guide patients with medication adjustments.
There are health disparities beginning to emerge around pharmacogenomics. Because of that, we have specifically developed our certificate program to focus on pharmacists who are practicing in rural and underserved areas. The idea being that individuals who live and receive their care in underserved and rural areas will not ever have access to pharmacogenomic guided care unless they have health professionals that are specifically trained in the area.
I primarily see patients who are on state Medicaid programs, primarily in a Hmong population, or I also see a number of patients who are refugees from other countries. There are a lot of health disparities in the patients that I see, and I found this one more way that we can make sure they're getting the right medication at the right dose and the right time. After finishing this course or this program, I am much better able to find the information when patients bring in their results, and it's helped me be a lot more efficient in my practice.
I have been a discovery scientist for 20 years, and we have made very substantial discoveries in pharmacogenomics, but there has been a real problem in getting those translated into clinical care. ECHO is based on the philosophy of all teach, all learn. An ECHO is not a didactic program where you learn from an expert. They don't provide a lecture to an individual, but everybody learns and teaches through a real life case. So the problems an individual may be having with their medications, how pharmacogenomic testing may help that individual, and actually what would be the interventions then that the healthcare professional could take to solve their medication-related problems.
Going to the ECHO is really comfortable. Two parts. One is that you're surrounded by others that are open to hearing your questions and might have the same questions as you. And the second is to get some support. You can often ask a question and others will tell you their experience. So you get supported, and as well as having your difficult questions or clinical questions answered.
The participants that generally participate in our ECHO program are primarily pharmacists, but we also have physicians that will attend. We've had nurses that have attended the pharmacogenomics ECHO. And they're individuals who are in the community, they're practicing individuals. They all have problems with a case that they want assistance with, but they're from all over.
The most important part of participating in the ECHOs is just exposure to experts and exposure to others that are doing the same work, looking at the same types of profiles, genetic profiles, and thinking about patients in a practical perspective.
We know that there are tools to prevent adverse drug reactions. We know there are tools to enhance efficacy of drugs and improve outcomes in patients. Pharmacogenomics is one of those very powerful approaches. We need to be implementing this into care so all patients have the advantage of PGX-guided care.